We found that before digital, most of our nurses were spending up to 50% of their time managing the record. Now they can spend that time engaging and managing patients, and that's what the privilege of being a healthcare worker is. You cannot give patients a doorstopper to read in terms of their hospital records, and we've got to make it easy for them to understand and de-jargonize it. And so digitizing our hospital records was the very first step in getting our doctors and nurses to be digital so that ultimately we could give patients a summary of care. And that meant changing the way we've practiced medicine for decades and decades in South Africa. We wanted a solution that allowed doctors and nurses to access the records of the patient away from the bedside. Because normally what happens is you get a call about a patient, you've got to rush to the bedside to read the manual records, whether you're in theatre, whether you're at home, wherever you are. We were very concerned about data protection, given the fact that we are now collecting everyone's data on a daily basis, real-time live, some 51 gigabytes of clinical data per day. And we wanted to make sure that we had the very best and most secure platform globally, and it's critical for us. We want that healthcare and those records to be available 24/7, wherever you are. We have just scratched the surface in terms of digital health. And we are going to use all of this information to empower patients to live healthier for longer, to concentrate on their health span, and be able to give them a holistic view, a digital twin, if you want, of their healthcare and who they are. And we're absolutely committed to doing that across all of our operating divisions.